It's great you talk about integrative and lifestyle medicine. So about 13 years ago, I got introduced to it when I was in the US. Yeah, I learned of that subject. I was still trying to find my path. I'm a nutritionist basically, and I didn't want to just do nutrition. So I had a really good mentor at Yale. And once he understood, what I wanted to do, he said, this is a subject. This is lifestyle medicine is a subject. And he said, this is what your country needs, because you'll have personal trainers, you'll have chefs, you'll have cooks, you'll have everything, but the gap is lifestyle. So I came back to India and I said, let me look around and understand what's going wrong. And it was exactly that. People had knowledge. The internet was blowing up at that point. We were still on Blackberries, although, BBM and all of that stuff, but there was information. But I saw the gap was lifestyle, even though people had everything. And I figured this is the line. And when I dive deeper into this subject, it made absolute sense. See, we have great medicine. You have great nutrition. You have great research. You have scientists. You have everything around. But it's fragmented. The patient is a whole. We can't just look at the heart without looking at other parts of the body. We can't look at the liver without looking at chronic stress levels, without looking at emotional wellness, without looking at nutrients, nutrition. So everything is very symptomatic based in medicine, which is not a problem. That's how medicine works. It's designed to, treat a symptom, and it can save lives. But what about addressing the root cause? So what if a patient is on a steroid or on a chemotherapy or on a diabetic drug? Fine, please, let the doctor do their job, take the medicine. But what about the root cause in the first place? Why do you have diabetes?
Correct.
Why do you potentially have a cancer? If I address the root cause, while the chemotherapy works, the radiation to break down your symptoms, how do we prevent a reoccurrence? For that, we can only address the root cause, because there is no medicine that can prevent reoccurrences. It comes down to lifestyle. So I think that little bit of detective work kind of fascinated me, that how do we get to the root cause of the problem. So integrative medicine is, number one, looking at the patient as a whole, bio-individuality. That means respecting the fact that every person is different. That's why no one drug will have the same medical outcome on all the patients. It will be different. Nor will the same food, nor will the same exercise or the hours of sleep, because everyone is different. So first is bio-individuality, getting people to respect their uniqueness. What works for you doesn't have to work for someone else. Then looking at the changing nature of disease. Disease is also changing. We saw that with the whole virus, how it could become something big and then slowly phase out and die down. We see that with environment changing and impacting the way pathogens, germs, or even cancers are expressing themselves. Basically coming down to your genes. How are they upregulating and downregulating with the impact of environment, external and also internal. My own. If I'm constantly stressed, my genes are behaving very differently when I'm happy and when I'm in balance. So you look at that. Then the root cause, like, why do I have this condition? What is it that I need to change along with my medicine? Take your medicine. But the beauty is, if I also change my lifestyle, your own doctor is going to look at your symptoms getting better and slowly reduce your medicine, come down to the lowest possible dosage, or even get you off, once you've addressed the root cause of the problem. So integrative and lifestyle medicine looks at these 4 pillars, which is cellular nutrition, not Google nutrition, but cellular, according to your cells,
not
your
the
mitochondria, your inflammatory levels, your CRP markers, because it's really about absorption of nutrients, synergistically working in your cells. So you have cellular nutrition. Then you have movement and exercise. What suits your body type? Not what the whole world is doing. Everyone responds. Your genes respond differently. Your absorption rate in your gut. So your exercise and movement. Third is your sleep. And fourth is your emotional wellness. And the fifth is your spirit. When I say your spirit, we're not talking about religion. We're talking about how connected are you with yourself.
Self-love.
Because that brings homeostasis in you. But when we're constantly outside searching, the immune system is erratic, there's always disharmony. So how do we bring these 5 pillars together for a patient? Let medicine do its job. It's not a fight against medicine. Of course, sometimes there's a fight because sometimes you're unnecessarily put onto a drug, and you're not told that if you change your lifestyle, you can get off. So there's always those things. And there's always the fight also with certain nutritionists that, hey, food can't solve every problem. Sometimes you need the drug. You need both of them to work together. So integrative medicine kind of breaks that gap. It's really about, we care for the patient. Okay, whatever works for the patient that doesn't cause harm, how do we put that together? How do we bring it together for the patient?
So I strongly believe in this because in our medical literature, we don't talk about it that much. We talked about the secondary prevention. Correct. The primary prevention is what that you are trying to get at, and when there is a disease, I strongly believe it has to be combined together. It's a marriage between medicine and also the supportive treatments. Among all the things that you talked about, you see so many patients, right? You see cancer patients, you see patients with diabetes, blood pressure, everything. I know you have some inspiring stories, right? You always talk about. Can you share with us a patient that inspired you based on the interventions that you did?
So I think, we have inspiring patients every single day, and that's what gives us strength,
satisfaction,
and strength. Like the other day, I had a 24-year-old girl just come out of hospital, and she got onto a Zoom call immediately because she was getting her diagnosis and a prognosis completed, and she had a second stage triple negative breast cancer. But she was like very calm talking to me, and so we're trained to identify something called low anger scores, where you put on a front like you're strong, nothing's happening, but inside, it's bottling up, and that's actually worse for you. It's better to be emotional about it, and then come to acceptance. And I asked her, we went through everything, understood what the doctors want to do, she understood what we're going to do, and then I asked her, I said, you're really calm, and you know what she said? She just said, Luke, I mean, it's a little bit of a shock, but, my God has gotten me through so many things in life. This is another thing that's come my way. He's going to get me through this as well. And the way she said it with faith and belief, right then, you have that gut instinct. I knew she's going to be fine.
Wow.
She's going to be fine. Just that attitude, that mental strength, it creates an energy for her as well as you.
Wow.
And right then, and it's amazing how a journey's been.
Wow.
These kind of patients, their chemotherapy works better on them in terms of they don't go through that many
You've
side
seen
effects.
That, huh?
The acceptance. They're in acceptance. See, I always believe if the human mind rejects something, the body rejects it. So a lot of people, I hate medicine. I'm afraid of medicine. And when they have to take it, for whatever, because they have to take it, it really doesn't work efficiently to someone. Okay, I'm wary about medicine. If I don't need to take it, I won't take it. But if I need to take it, I'll go. I'm taking it with trust and faith. I mean, we all know the placebo effect is real. Pharmaceuticals use that as a benchmark for their drugs to come out into the market. So if it is real, how do we get it into our practices?
Wow.
And then we've seen simple things. We've seen patients who have complicated issues and they've come on our plans and stuff. And when you're looking at everything, you find out, okay, this person is so sleep deprived. And sometimes we start getting them, to honor their sleep, and you won't believe it. They don't need nutrition. It was only the sleep that they needed. Something as small as sleep can literally bring correction in their body. Now, I don't mean to say sleep and don't take medicines and everything's going to be fine. You get my point. It's inspiring when you see how these small, powerful things like sleep just brings the body back into balance and they start to feel better. The same thing with food. We have people who have metabolic syndromes, junk food, ultra-processed food, diabetes. And only when they realize, like, I've decided I don't want to live like this anymore. So they decide to start changing their nutrition. And we put them on simple, basic stuff. But in a week, just changing from junk to natural food, they feel their energy levels come up, blood sugar drops. So these are like inspiring moments to show you that it's possible with even the smallest change. Someone who's sedentary, they just start walking for 20 minutes a day. A week later, they're, Luke, what's next? I need to work out more. I feel so great. My muscle pain's disappearing. So I think the inspiring part is, and then we see miracles all the time.
Right.
We see miracles where medicine doesn't work anymore, like a 4th stage cancer, palliative care. And then this patient is like, hey, Luke, I'm just going to pray and I want other people to pray. They join prayer groups where people just pray for them, group energy. And you see miracles which I know science can't explain,
sometimes
medicine can't explain, life can't explain. But that inspires us to believe that there is a higher power. Some people call it God, some people call it the universe. But the beauty is there is something, and sometimes it humbles us. That like when I look at, like I always ask people, whatever you've achieved in life right now, is it everything that you've done alone? They say, no. Then who's done that? Who's helped you so far? And then we start realizing, we need to use all these energies. I mean, medicine's great, nutrition is great, but it's not everything.
Right.
It's not everything. Everything is when you put all these things together. So these are inspiring stories. I mean, cancer patients, I know it's a stigma. And see, there is destiny. You know, I'm not here to say that everyone will live if you do all of these things. I mean, if my destiny is planned in the next hour, it doesn't matter who I am, how fit I am, what I eat, it's planned. But we don't understand destiny. So we leave it in the corner and we focus on what we can do.
Can I ask you a question on that?
Sure.
All the YouTube comments on my videos, when I say that don't eat the full restaurant biryani, you split it.
Yeah.
The first comment is that for this, you can die. I better live whatever I want to.
Yeah.
And then if I want to die early, it's okay. You know, this is not what I want. What do you tell them?
See, I think it's a mindset change. The point is, yeah, fine. So you want to eat that much and die early, but you'll be happy. But what if you could still eat, not overeat it, share it, and live longer? You have a longer time to enjoy what you like to eat. It's a mindset change. So I think, you know, as an Indian culture, we're very emotionally attached to food. And that's not a problem. It's a good thing. Because emotional attachment to food makes us happy. Rather than you've seen people on extreme diets, you know, not eating this, not eating, and they're always so tight and angry and extremes and fighting. They have a bigger problem. Their anger and their own hatred is going to be their biggest issue. But the point is, I can be emotional with food, but what's my balance? What's my balance? Of course, splitting a biryani, then maybe you can do it again next week. Rather than doing the whole biryani today and then you're on antacids and you have all these issues and you feel horrible about yourself.